Have you ever been dealing with, a massive life change, and the conventional wisdom you're handed just feels completely unsatisfying?
Oh, yeah. And we are absolutely talking about menopause here. You go to the doctor, and the lecture you get, it sort of boils down to your estrogen went down, so just take some estrogen.
Right. As if it's just simple physics,
Mm.
a basic top-up.
Exactly.
But if it's truly that simple, why do so many women find themselves in what feels like a prescription cocktail hour? A pill for the night sweats, something else for the weight gain.
An antidepressant for the mood swings, something for the joint pain that just appeared out of nowhere.
Yeah.
It's a classic case of what we call polypharmacy many drugs, and they're all being used to treat these symptoms as if they're separate issues.
But they're not separate at all, are they?
Not even close. They're all leaves on the same tree. And the real root cause is getting completely missed because of this singular focus on hormone replacement therapy, or HRT.
And that's the lie, isn't it? That the only problem is the estrogen dip. But HRT comes with some serious baggage, increased risks for certain cancers, stroke, blood clots. It makes people look for other options.
Of course. And what they find is that the body's actual instruction manual was never even consulted.
So today, in this deep dive, we're going to dig right past that obvious hormone drop.
We want to find the real master switch in your brain and uncover some really surprising nutritional cofactors that explain this whole menopausal cascade. Okay, so let's unpack this.
All right, let's start with the basics. Around age 52 or so, the ovaries. They basically hand in their retirement papers.
That's a great way to put it. They stop releasing eggs and boom, the hormonal crash happens. Estrogen can plummet, maybe from a level of 400 down to like 20.
But it's not just estrogen, right?
No, we always forget the other players. Testosterone also declines, and progesterone, that one can tank to almost zero. But here's the thing. The ovaries retired, but they handed the keys to the brain's control room, the hypothalamus, with this really vague, scribbled note about what to do next.
I love that. So the hypothalamus is this, like, microcomputer in your brain. It's the master gland running everything.
Everything. Thirst, hunger, and critically, your literal internal thermostat.
And that thermostat usually has a pretty big margin for error. It's like your home thermostat set to 72. It doesn't freak out if it hits 73, right?
Of course not. There's a zone, an acceptable temperature range.
But when estrogen drops out of the picture, that zone, it just narrows dramatically.
It gets hypersensitive. It's like your home thermostat suddenly tripping the AC the second the temperature hits 72.1.
So a tiny little change that your body would have ignored before.
Yeah, like a small dip in blood sugar, a bit of stress, even just walking into a warm room, it instantly trips the alarm.
And that alarm is the hot flash.
That's the hot flash, or the night sweats, or even getting the shivers when your body overcorrects.
And it's not just temperature. This same bit of the brain controls appetite, cravings, energy, and, this is the frustrating one, your body's weight set point. So you are not imagining it. That stubborn midsection fat gain is literally your hypothalamus recalibrating its settings because the signals are all fuzzy now.
Which brings us to where it all starts to connect and where it gets, really interesting. The problem isn't just the lack of estrogen. It's the system failure that lack of estrogen causes.
Okay.
Get this. Studies show that if you already have insulin resistance or prediabetes, your risk of having severe hot flashes actually double.
Wait, hold on. So the symptoms we all think are purely hormonal are actually being driven by a metabolic problem. That feels completely backwards.
It is structurally backwards. See, before menopause, estrogen was your metabolic bodyguard. It was protecting the beta cells in your pancreas, the ones that manage blood sugar. It kept your whole system sensitive to insulin.
So when the estrogen goes?
That protection goes with it. And your body starts becoming resistant to insulin's cues.
Okay, so if your cells are resistant, they can't take in sugar properly. So the sugar just starts piling up in your blood. What does the body do then?
It panics. The liver, which is supposed to be storing sugar, can't absorb it efficiently anymore because of that resistance. So it misreads the situation entirely.
And things like?
It signals to the brain, emergency, we are starving. So in response, the liver starts churning out its own sugar like crazy.
An internal sugar factory.
An internal sugar factory running 24/7. So even if you're cutting carbs, your body is making its own sugar, which just makes the inflammation worse. And that inflammation, remember?
That narrows that thermostat zone even more.
It's the perfect metabolic storm.
Wow. Okay, let's pivot for a second. There's this this really strange global clue you mentioned.
There is. If you look at different populations, the data is really striking. Between 80 and 91% of African American women report having hot flashes. That number is way higher than other groups, and you have to ask why.
My mind immediately goes to vitamin D
Hmm.
because of skin color and sun absorption.
You're on the right track. Melanin is a natural sunblock, so the darker your skin, the harder it is to make vitamin D from the sun, especially if you live far from the equator.
So low vitamin D is linked to more hot flashes.
Highly correlated. But it's not just a simple deficiency. This is the key part. Vitamin D and estrogen are in a codependent relationship.
A bidirectional link. Okay, break that down for us.
All right. First, you need estrogen to activate the vitamin D you get. That conversion from inactive to active happens in your kidneys, and estrogen is essential for it.
So even if I start taking, say, 5,000 units of vitamin D, if my estrogen is low, my body can't really use it properly.
Exactly, which explains why sometimes supplementation doesn't seem to do anything. But it goes the other way, too.
How so?
You also need vitamin D for the enzyme that converts your leftover testosterone into estrogen. Your body has this backup system, using testosterone from your adrenals and fat cells.
To make it for the retired ovaries.
Right. But if your vitamin D is low, that backup system stalls out. They need each other. It is a genuine double-edged sword.
And yet the official medical advice is still something like, what, 600 to 800 IUs of D3 a day?
It's laughable. It's so inadequate. To run your immune system, your muscles, your bones, and this crucial hormone conversion system, realistically, you need 6,000 to 10,000 IUs daily just for maintenance.
And a lot of labs will say a D level of like 20 is normal.
Which for a menopausal woman is basically a recipe for systemic collapse.
And that's where we see the bone loss, right? The osteopenia and osteoporosis. We think it's a calcium problem.
But it's really a D problem. When D is low, your body panics and spikes something called parathyroid hormone, or PTH. And PTH's job is to get calcium into the blood, and the easiest place to get it from
Is your bones.
It literally steals calcium from your bones to solve the more immediate problem.
That's incredible. So the bottom line here is the estrogen dick is normal. It's supposed to happen. The systemic failure it uncovers is the real problem.
Yes. The mission isn't to blast your estrogen back to what it was when you were 30. It's to fix the root problems, the insulin resistance, the vitamin D deficiency, so the hormones you do have left can actually work properly.
Okay, so let's talk about the plan. And thankfully, it sounds a lot simpler than managing that prescription cocktail. Strategy 1, fix the insulin resistance.
And you can do that aggressively with diet. Drastically cutting refined carbs and bringing in some intermittent fasting. You can turn that around surprisingly fast.
Strategy 2, a massive D3 boost.
A massive boost. Maybe starting with something like 20,000 IUs a day for a little while, then dropping to a maintenance dose. But, and this is critical, you have to take it with its cofactors, magnesium and vitamin K2.
Right. And while you're working on those big fixes, there are things for immediate relief, aren't there? These natural drug mimickers.
Yeah, things that help with symptoms without the side effects. Black cohosh is very popular and very effective for hot flashes. Resveratrol and red clover can also help modulate things gently.
And what about that master switch in the brain, the hypothalamus?
Don't forget that. It's super sensitive to light. So you can help reset that jumpy thermostat by getting back in sync with your circadian rhythm.
So that means getting real morning sun for maybe 20 minutes. Or, using one of those full spectrum lights. And then at night.
At night, you simulate darkness, blue blocking glasses, dim the lights. Give that microcomputer in your head the clear signals it's desperate for.
And what about the other hormones, progesterone and testosterone?
Well, since progesterone tanks so hard, a topical progesterone cream can be a huge help, especially for sleep. And in more severe cases, getting your testosterone checked is a good idea. P is the mother hormone that feeds that backup estrogen conversion.
So really, what does this all mean for you listening? If modern medicine is just treating the symptoms, one by one, are we really treating a deficiency, or are we just ignoring the instruction manual for the body's most sophisticated system?
It makes you wonder, doesn't it, how often the answer isn't some complex new drug, but just giving the body the simple, essential building blocks it needed all along.